It's taken nearly 6 years for the Competition Commission's Health Market Inquiry to diagnose the factors which prevent, distort or restrict competition in the private healthcare industry. The panel looking into the matter recommends more oversight in the sector to help keep those issues at bay. Ntuthuko Bhengu, who's panel member of the Health Market Inquiry, joins us in studio now with more perspective on the findings and how it impacts the drive towards a national health insurance. Thanks so much, Ntuthuko, for joining us in studio this evening. So the inquiry has laid the blame on the National Health Department for the most part for failing to hold regulators sufficiently accountable, and that having led to uncompetitive and inefficient behavior within the sector. Are you surprised that the Health Department, who pushed this entire agenda, never submitted a single report to the market inquiry in the first place?
No, thank you, Alicia. Thanks for having me, and good evening to your viewers as well. Well, it's not really true that the department has never submitted. I think the chair referred to the fact that since the provisional report was published, the department has not made written submissions, but they had participated before, right up to the publication of the provisional report.
So no need to table things further than those original submissions made to the inquiry. Within that context, when it comes to turning this picture around, how does a supply-side regulator for the healthcare sector being established start helping this situation?
Yes. Yeah, the starting point is really that if you look at healthcare, you have the supply side and the funder side. The funder side is regulated, even though we say the regulations aren't comprehensive. On the provision side, which is where hospitals and practitioners play, there actually isn't any regulation, very little regulation beyond just being certified as a licensed practitioner or as a hospital that structurally is safe enough to see or admit patients. But it's actually the behavior and the practices that are not regulated. And we are saying, first of all, there is a need to bring that to bear, but also only because people, how they behave, respond to incentives. So it's critical to do that, but the supply-side regulator is intended to also bring some sort of synergies, because some of the regulations that are in place, the problem is that they are fragmented, and there needs to be collaboration with other departments that actually feed into what this is supposed to do. And indeed, some of the work that hasn't been implemented is in the law already. And I think the judge did make that point, that the department could have implemented some of the issues that we are trying to correct now.
Who would hold this supply-side regulator accountable? Would it not fall under the health department as well?
Okay. We by and large, we are advocating for an independent supply-side regulator. But having said that, we recognize that the Minister of Health is the custodian of all private and public sector. In that regard, we do propose that after a public process, the Minister will appoint the board. But that is where it ends, because the independence must now start with the board itself choosing its own chair, and the board appointing the CEO and the other executives. And those key roles we are not saying should be driven by the department directly. And that theme of independence flows through, because we do believe that it wouldn't necessarily be in the interest of the country for all private and public sector to have one single point of possible failure.
Is this why we've seen the U-turn being made on private hospital groups needing to sell off some of their assets in a bid to enhance competition in the sector?
Yeah, indeed. I mean, when we, during the provisional report, when we considered divestiture it was really as part of a suite of possible remedies, given that we had found that the industry is highly concentrated and thus competition is suboptimal. But what we have done, or what the U-turn, as you call it, is testament to the fact that we have committed to apply our minds to stakeholder submissions, and in that regard, the issues that we took into account, we do believe that the hospital groups made a very good case of why this is not necessarily the best way to go. We looked at international practice as to how easy or how complex this is.
Yeah.
We looked at the proportionality, whether a divestiture would fit the issues that we identified. But we didn't leave it there. We came up with a comprehensive suite of recommendations that will now, going forward, deal with the issue of saying we need to start reducing the concentration, and it starts right from the licensing and the issue of sale of licenses being reportable, right up to the Competition Commission looking at merger activity.
Yeah. Ntuthuko, of course, these are just some of the recommendations you've put on the table. You've also made recommendations around medical schemes and how they should be operating more on a more transparent basis. Very, very quickly, what kind of timeline have you laid out for recommendations to start taking effect?
Yeah, the issue here is that it's now out of our hands. The process will be going to Parliament, and our recommendations largely are directed at the Department of Health, but some to the Department of Trade and Industry. So it's now a function of their timelines. But what we did highlight some that are so urgent that we have proposed interim proposals for, and that includes pricing, that includes licensing of hospitals. Okay,
well, we'll be tracking developments there as they unfold. Thanks so much for having joined us in studio this evening. Of course, Ntuthuko Bhengu is a panel member of the Health Market Inquiry.